This is the nasogastric tube insertion station. It's a 12-minute station. You'll be required to insert the nasogastric tube for the patient to enable us pass feed, like feed the patient, and also administer his medications as well. And the doctor has already discussed this with the patient. So your patient will be a mannequin and the assessor will be the voice of the patient. I will do the demonstration now to show you how to do this according to NMC standard. I will declare that the scene is safe for me to approach. I will do a 7 steps of hand hygiene, palm to palm, back of the hands, finger interlace, back of the fingers, fingertips to palm, thumbs, wrists, and allow to dry for 30 seconds. Assessor, can I assume 30 seconds is gone?
Yes.
Okay. Good morning.
Morning.
My name is Chenwe and I'm the nurse. I've actually come to assist with your NG tube insertion. Is that okay?
Yes, sure.
What would you like me to call you?
Just call me Sue.
Okay, Sue. Assessor, can I assume Sue's ID, allergy and pain assessment has been done?
Yes,
And Sue's observations have been checked and they're within the normal range?
they are.
Okay, so I will ensure there is a suction and oxygen machine at Sue's bedside before I proceed.
Okay.
Sue, so we are actually going to insert your NG today. I believe the doctor has discussed this with you.
Yes.
This is for us to feed you and also pass your medication. Is that okay?
Right.
Okay, and are you comfortable and happy for me to proceed?
Yes.
All right, I'm just going to provide privacy. And do you mind sitting upright for me in a semi-upright position?
Yes.
Pillows behind your head. Okay, I'm just going to leave you now and get the items ready and I'll come back to you. Is that okay? Okay, leave Sue, gel my hands, wear my apron. Assessor, can I assume the trolley is clean and ready to use?
Yes.
Okay. Okay, so everything is in the tray. I still need to check the expiry date. I have the disposable receiver that needs to go into the clinical waste after use as well. I need a pair of gloves. Now I am going to check the expiry date of the items I will be using. So the NG tube, this is 8 French and is in date till 2028. So I'm actually happy to use it and it's the right size for Sue. I have the 60 ml syringe and is also in date till 2025. I am happy to use this as well. I have the pH strip and is in date till 2025. I have my tape, a tray, and I have the sterile water. And I have my disposable tray too. Now I will go back to Sue. Gel my hands. Sue, I'm back now. Are you happy for us to proceed?
Yes.
Okay. So I'm just going to bring out the tapes first, prepared before I start. Okay. So I'm actually going to check the patency of your nostril now. Is that okay?
Yes, sure.
Okay, do you mind closing your left nostril and then sniffing with the right one for me? Okay, and do you mind closing the right one? Do you mind closing the left one and sniffing with the right one for me? Okay, and are both of them patent?
Yes.
Okay, and which of the nostrils would you like me to use?
The left one, please.
All right, that's fine. Now, I will actually check your next measurement. And throughout this procedure, when I start inserting, okay, if you feel any discomfort, just raise your hand for me and I'll stop, okay?
Right.
So first things first, I will just check the next measurement. I will check this, placing it at the bridge of the nose, okay, to the earlobe, and from the earlobe to the symphysis sternum. Okay, so that's 52. Okay, so So I'm going to put some sterile water now, and I will lubricate about 15 to 20 centimeters. Okay. Okay, Sue, so I'm just about to start the insertion, okay? And this is a disposable receiver tray if you need it. Is that okay? In case you want to vomit or something, all right? And also remember to raise your hands, like I said, if you feel any discomfort, okay? Or you want me to stop.
Sure.
All right? So I'm just going to start inserting now till we get to the next measurement, okay? And I want you to keep swallowing. Is that okay?
Yeah.
Okay, and I can see there is no calling in the mouth. All right, I'll keep inserting backward, going in. I do not feel any resistance, and I can see any calling in the mouth. Okay, I can see Sue is not in any form of distress. The tube is not calling in the mouth as well. And I keep going till we get to the next measurement. All right, and we're there now, okay? So I will just get the tape and just put it on the nostril. I have prepared the tape already, so I'm just going to fasten it to the nostril. Okay, so I've just fastened it. Okay, so I'm just going to take a gastric aspirate now.
Okay.
And I would take 0.5, between 0.5 to 1 ml. I've just taken that, and I will tighten this back up. Okay.
We'll just assume that's the aspirate you just took.
Okay. And I will take the pH strip. I will take one, put it flat on this tray, and cover it back up. Now I will actually put the gastric aspirate over the strip. Okay. Okay, I'm going to check the pH now. And this is a pH of 2. I'm going to discard the pH strip with the glove, apron, and everything else into the clinical waste. Gel my hands. So
Yes.
I'm done now, and I've just checked your pH, okay?
Okay.
You have a pH of 2, which is below 5.5. So the tube is actually in the right place, okay?
Right.
But before we use this tube to feed or give medication, all right, we will have to check your pH test again. If you vomit, or there is any coughing or any retching, or if we notice any respiratory symptoms, okay, we would actually do another pH test. Is that okay? Or if there is any displacement of the tube at the nostril, we will check your pH again. Okay. Do you have any questions for me at all?
Yeah, I think that's it.
Okay. And what about the receiver? Do you want to keep a hold of it for a while, or do you want me to take it away with me?
Keep that, please.
Okay. All right. I'm just going to leave it for now. All right. And when you're done, we will discard it into the clinical waste bin. Okay. So I'll leave you now. This is the buzzer. Press the buzzer, and I'll come back to see you in about 30 minutes. Okay.
Okay.
All right, assessor, I'm done now. Okay. I'm just going to discard the syringe as well into the clinical waste bin with this one. And I'm going to clean the remaining items and get them ready for next use, and I'll go back to see Sue in about 30 minutes, and the receiver would be thrown into the clinical waste when she's done. I will do another 7 steps of hand hygiene: palm to palm, back of the hands, finger interlace, back of the fingers, fingertips to palm, thumbs, wrists, and allow to dry for 30 seconds.